Here are some common probing technique errors with best practice solutions. Don't drag the probe across the sulcus, or do the opposite of jiggling the tip up and down too fast. Instead, do a 1 to 2 millimeter walking stroke at a slow and steady pace. Use the same concept on posterior teeth as well. To stay adapted, don't let the probe come across the long axis of the tooth. Instead, keep the probe parallel with the long axis of the tooth at all times by pivoting on the fulcrum finger. Use the same concept on posterior teeth as well. If you're too flat or flush with the tooth, you won't be able to access the sulcus. Instead, keep the tip flared out slightly to better access the sulcus. Use the same concept on posterior teeth as well. For best adaptation, the shank should not be over the top of the tooth or the occlusal plane. Instead, keep it parallel with the occlusal plane. Use the same concept on posterior teeth as well. To fully access the interproximal space, don't stop at the line angle. Instead, walk the probe right up to the contact into the embrasure space. Then tilt halfway across the tooth into the caul. Use the same concept on posterior teeth as well. Avoid tipping too far into the caul or not tipping enough into the caul to fully be able to access the interproximal space. Also, when working on a tooth with no contact, you can just take the direct interproximal reading without having to tilt the probe. And the last one is reading the probe incorrectly, so be sure to check out our videos on how to determine the probe depth with different types of probes.